Clerk, please call the roll.
Senator Douglas.
Here.
Senator Southworth. Senator Yates. Representative Bowling.
Here.
Representative Hart.
Here.
Representative Mentor. Senator Meredith.
Here.
Chairman Cook.
Here. First item on the agenda is consideration of the minutes of the April 12th meeting of the committee. Is there a motion that they be considered as being approved?
Motion.
Motion by Senator Douglas. Is there a second? Second by Representative Hart. Clerk, please call the roll.
Senator Douglas.
Yay.
Senator Southworth.
Aye.
Senator Yates. Representative Bowling.
Aye.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Aye, motion carries. Total number of items on the agenda today, we have 665 in the amount of $349,650,927.86. All May agenda voters are registered with the Secretary of State's office. Oh, vendors, not voters. Primary campaign season. Next is the deferred list. Note that number 50 from the March routine personal service contracts list, Murray State University has withdrawn the contract. Next order of business is consideration of the agenda, including the deferred list, personal service contract list, the PSC amendment list, memoranda of agreement list, the memoranda of agreement amendment list, and Kentucky Entertainment Incentive Program agreement list, except for those items selected for further review. Do we have a motion to consider the contracts reviewed without objection?
Make a motion.
Motion by Representative Bowling. Is there a second? Second by Senator Douglas. Clerk, all those in favor vote aye. All opposed, no. Clerk, please call the roll.
Senator Douglas.
Aye.
Senator Southworth.
Display my vote, Mr. Chairman.
Yes.
I'm voting no on this today. There are just a number of contracts throughout, and it's just too many to call individually relating to voting equipment specifically. There could be others, but that's the one I want to bring out today. Voting equipment in a lot of our counties, obviously we're getting into election season. It's not the first time we've bought these machines. It's not going to be the last, apparently, but it will be the last soon, hopefully. I'm looking forward to that. But I don't think we need to spend millions of our taxpayers' dollars or prove that on machines that we know are not secure and claim that they are. Certainly there's a need for better election processing in this state, but it's definitely not the answer. Thank you.
Senator Yates. Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Yes. Motion carries. We need a motion to approve the corrections list. Do we have a motion to approve the corrections list? Second? Second by Representative Bowling. Clerk, please call the roll.
Senator Douglas.
Aye.
Senator Southworth.
Aye.
Senator Yates. Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Aye. Motion carries. Okay, in order to accommodate an agency, the first item on the pulled list with Economic Development, Office of the Secretary, and they are numbered 94 and 95 on the routine PSC green list. Representatives are here. You're already moving forward. Please identify yourself for the record.
Can you go and transfer that money?
Is it 9?
Yeah.
All right, we got a hotline.
You have 2,000 in your account.
We have if you're online, you might want to silence. There you go. All right, welcome.
Good morning. I'm Katie Smith, the Deputy Secretary and Commissioner of the Department for Financial Services at the Cabinet.
Angelica Sanchez Vega, Executive Advisor at the Cabinet for Economic Development with the Office of Legal Services.
Welcome. Co-Chairman Meredith and I have questions, and I did a little research on these last night and got some background information, but if you all could just talk about these two contracts a little bit and some of the successes we've had with them, I think that would be much appreciated.
There we go. Sorry. Technical difficulties with the microphone. Yes, we have been working with, in the European office, we have Finn Weiss that has been our European representative office. He's ran that office for several years. Thankfully, over the past couple of years during the pandemic, they've been able to continue to work with the organizations that we have facilities here and for potential projects that are considering locating here in Kentucky from Europe that we couldn't travel, and they couldn't travel as well. So we have been working with him. He has helped us with various projects. We have several German companies here that they've helped us with locating as well as additional expansions. Over in Asia, we have in Japan, Mike Takahashi. We've had his contract as well. And again, especially because of the pandemic and COVID, he's been able to help with us with projects. I know in the past, during the pandemic, we worked on a big project that's going to be locating in Louisville, House Foods. It's a tofu company. And that's going to also be helping with ag because they're going to be sourcing some of their products from locally here in Kentucky as well. So they have been managing the offices. We work with them. They help find projects, and then they kind of work with our project managers here in the United States so that we can perform the site visits. When representatives from Japan, or if they're here in the United States, visit Kentucky, they transition and work with our project managers here locally so that they don't have to travel. Sometimes they do travel. But that's kind of how these two contracts work. They are our representatives overseas and working with the companies.
In my understanding, these go way back even long before COVID.
That is correct.
These are
Yeah,
standing
it's
for-
a long-standing relationship with both vendors that really spans at this point across a number of administrations.
And at one point, our Finn, our representative in Europe, actually lived in Kentucky for a couple of years. So he's very familiar with Kentucky, and Mike has been here and visited over the years as well.
Co-Chairman Meredith?
Thank you. Appreciate the additional documentation that you gave us, particularly with regard to Mr. Weiss. I'm surprised I didn't see the same thing for Mr. Takahashi. You know, I like what you give me that during his tenure we've seen 14,000 jobs, 4.6 billion in new capital investments, but we didn't see comparable numbers for the other contract. And you know, I'm not questioning whether we need these. We certainly do, but I'm just curious, particularly long-standing relationships that are sole source. Probably anytime you have a sole source contract, I'm going to question because I want to know. Is a contract out of convenience, or how do you truly measure the effectiveness of both of these individuals that are doing what they need to do? You know, 14,000 jobs, 4.6 billion in new capital investment. Is that directly related to him, or is it just natural growth of some of the companies we already have here? So again, I'm not really questioning the integrity or value of either one of these individuals. Just how do you measure their effectiveness in, even though it's a long-standing relationship, how do you know someone else might not be more effective in those roles? So again, I guess I'm just looking at the process. Whenever you look at these contracts, are they automatic renewal, or are you really giving some scrutiny to them as to whether they're really producing the way they should or not?
So as it relates to the numbers, Katie, and please feel free to jump in. I mean, we can certainly provide you additional numbers for the Japan office. In terms of how do we keep track as to whether these vendors are performing, we work extraordinarily closely with them. The project managers here in business development work with them really in a really well-coordinated manner. So it is fairly evident, I guess, to the project managers and the day-to-day business development team as to whether there is assistance being provided there and there are valuable services being provided there, whether that be outreach overseas, whether that be event translation services, whether that be navigating business culture and the formalities of foreign business entities, et cetera. So again, we completely understand that concern. It's a very valid concern. Do know that we work hand in hand with them. It's not like we simply award the contract and do nothing else with them. We're in constant contact with them, and we require constant updates. In fact, they provide weekly updates to the business development team.
As well as they have a weekly one-on-one meeting with our cabinet secretary to talk about the activities and the projects that they're working. And so if the performance is not there, we don't wait. We kind of communicate back with them as to, okay, you know, you've been doing a lot of trade shows, but now we want to have some more, you know, you need to reach out to some of these companies and have some one-on-ones, and then they've done that as well. So we do stay on top of them and their activities and their performance to make sure that they are truly working with us and working with potential projects and opportunities that are seriously considering Kentucky. And they, as you mentioned, you know, they have also helped with different things with translations and marketing Kentucky overseas as well.
I'm curious as how we cover the rest of the world, because it looks like these gentlemen are covering Europe and Southeast Asia, but how do we cover the rest of the world?
There is a international affairs director out of the cabinet for economic development, and of course the business development team to try and capture some of those opportunities. I mean, would we like to see additional coverage based on sort of geography? Yes, we of course need more operational resources to be able to do that. But in the meantime, that's how we do it. It's not like we just serve those or focus on those two geographic areas. Every other opportunity we do our best to capture from here, from Kentucky, from the cabinet, and that includes outreach. It includes attending conference. It includes assistance to trade shows. I know we're getting ready for Select USA, which is kind of a major event in DC to meet with foreign businesses from all over the world who are interested in investing here.
All right, thank you, Mr. Chair. That's all I have.
Senator Douglas.
Thank you, Mr. Chair. Perhaps you've answered this, and I just didn't hear it in the answer, but are there other vendors or persons who inquire about these contracts, or are there other persons or vendors who even know that these contracts come up for renewal and have an opportunity to perhaps see if they could do a better job?
So for the renewals, we do not do an RFP. We do the not practical to bid because we have been working with these vendors for a while. I know historically at the beginning there was, I believe, an RFP, and that's when we had responses and interested vendors, and then they continue to work with us. I know in Asia and Japan, for a while we also had for years Jiro Hashimoto was also one of our vendors for quite some time as well. The difficulty sometimes with the RFPs is, I know when there was an RFP, there was a visit to Japan to sit down to actually do one-on-one interviews with the various vendors. And then that has happened a couple of times, but because of the working relationship and the performance that we have with Mr. Takahashi as well as Mr. Weiss, we felt it was pertinent for us to continue their services instead of doing another RFP because we feel like they are performing and helping us grow.
Yes, sir.
Do we not pursue it because it's not practical or because it's not convenient?
I would say that there are some not practicable sort of logistical challenges with this particular operations. Again, because we're not talking about vendors that are even just by virtue of what they do here in the United States, right? Mm-hmm. They are in foreign territories. So we're looking at individuals that are uniquely qualified to really bridge that gap between Kentucky business culture and a foreign culture. So that's difficulty number one. Difficulty number two, of course, is the cost of what it would take us to create this RFP process. As you mentioned, it would potentially require us to travel abroad to understand who the vendors are over there, not even the vendors, but anyone who applies or decides to submit for this RFP. I mean, in addition, on the practical to bid kind of requirements, one of the recognized kind of exemptions for this is, of course, any type of like foreign translation services, et cetera. Of course, these offices do a lot more than that, right? But they also provide these types of services for us on the business side. I hope that at least answers some of your question, Senator.
Thank you, Mr. Chairman.
Yes, sir. Any further questions or follow-ups?
Motion to approve.
We have a motion to approve by Co-Chairman Meredith. Is there a second by Representative Bowling? Clerk, please call the roll.
Senator Douglas,
Aye.
Senator Southworth,
Aye.
Senator Yates, Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
Aye.
Chairman Cook.
Aye. Motion carries. Thank you all for being with us today. Next item on the pulled list are with Behavior Health Development and Intellectual Disabilities. It's numbered 9, 10, and 11 on the routine PSC green list. Well, please come forward. They're already on the move, so welcome. Please introduce yourself for the record. Just, I don't know if it's on or maybe this needs to get a little closer. All right, thank you.
Stephanie Craycraft, Deputy Commissioner, Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Welcome, thank you.
Thank you.
Good morning, I'm Jennifer Moore, I'm assistant.
Same thing, check your mic here.
Good morning, I'm Jennifer Moore, and I'm with the Department for Behavioral Health, Developmental, and Intellectual Disabilities, and I'm an assistant director.
Thank you. Thank you for being with us this morning. Co-Chairman Meredith has questions.
Thank you, Co-Chair Cook. Just for the other committee members, historical perspective, I've been on this committee since 2018, and every year we see these contracts. And this isn't a criticism of you folks at all. I understand the need for them, but I am curious as to, every year these are multi-million-dollar contracts, and locum tenens are never an inexpensive proposition. So I'm just curious as to what the impediments are to recruiting, hiring full-time staff, so we don't have to rely so much on locums. I know this will always be part of what you do, but is there a plan in place to try to recruit permanent staffing so we don't have to rely so much on these? Because again, it's a very expensive proposition that when we do it. So, but if there's some significant impediments to recruiting permanent people, I'd appreciate knowing what that is too. So I guess in summary, just curious what the plan is.
So currently we do recruit doctors locally. All of our physicians are contracted, but the majority of those are contracted through the community mental health centers that are partnered with the psychiatric hospitals that are in those areas. I think right now we have 38 physicians for our state-operated facilities. 8 of those are through locum tenens contracts. 28 are through the community mental health centers that we work with, and then there are 2 that are on personal service contracts. So we do recruit heavily, and again, for the most part, are able to hire through those community mental health centers. But we do support with locum tenens when necessary.
Have you seen any significant changes in staffing over the past 3 or 4 years?
Staffing has been extremely challenging for the past 3 years, and that's for all of our facilities and really almost all physician types, whether it's correctional officers, nurses, physicians. We have had a lot of longevity. We have some good doctors through the community mental health centers that have been with our facilities for quite some time, but there's been a couple areas where we've tried to recruit in, and there's been some challenges.
Can you give me some idea what the turnover has been the last couple of 3 years, percentage-wise?
I really don't think we've had very much turnover in our physicians. So we have, I'll have to get those numbers, but I can only think of about maybe 4 or 5 that were in positions such as medical directors or, that were like full-term physicians that have left over the past 3 years.
And these 3 particular contracts I pulled, totals over $21 million. And over a 2-year period, that's not a significant number in itself, but are these contracts not to exceed?
Yes, and we typically do not use that. We try to leave the contracts enough on that each one of our facilities needed a couple of the different physician types, that there would be room for that. But I think last year we spent around $3.5 million in total on all of them.
How much, excuse me?
$3.5 million in total, a little less than 3.5.
That's excellent. That's a good number. I appreciate that. Are there, other than the shortage of personnel right now, which seems to be across the whole spectrum of healthcare, is there any particular impediments to recruiting for you all?
I think not anything that any other medical providers are not having right now.
Okay, I appreciate that greatly. That's the only question I have, Mr. Chair.
Thank you, Chairman Meredith. Senator Douglas.
I guess this will be a day I actually say something. I just have one quick question. I noticed that all the vendors, the agencies that we're using are out of state. What are the impediments to finding vendors within the state of Kentucky so we can keep some of our money in Kentucky?
We actually, when these contracts were bid, I think in 2018, and the RFP was open for a month, and there were 21 vendors notified, and we awarded contracts to every responsive vendor. So had there been responsive vendors in the Commonwealth, we would have awarded a contract to them.
Thank you. Thank you, Mr. Chair.
Thanks, Senator Douglas. That seems to be I think we see that a lot, where, and then when we ask the question, it's, why no Kentucky vendors, and they never applied. They never filled out the RFP process, so don't know what the reason for that is, but seems to be an ongoing thing, as well as staffing issues. That's not just a healthcare issue, that's across the board, and from agriculture to healthcare, it's everywhere. If there are no further questions, I'll entertain a motion. Motion by Co-Chairman Meredith, second by Senator Douglas. Clerk, please call the roll.
Senator Douglas.
Aye.
Senator Southworth.
Aye.
Senator Yates. Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Aye. Motion carries. Thank you all. Thank you for being here. Next item on the polled list is with Personnel, Office of the Secretary. It's number 153 on the routine PSC green list. If the representatives are here, please identify yourself for the record. Here, they're coming online now.
Good morning. My name is Gordon Rowe. I am the General Counsel for the Personnel Cabinet. I have with me Alan Hurst, who is the Director of our Office of Employee Relations, and we're here to talk about this contract.
All right, good morning. Thanks for being with us online there. Senator Meredith has questions.
I do appreciate you joining us this morning. And when we last looked at this contract, a lot of concern and consternation about the history of this thing. And I won't bore you folks are repeating that, but as a direct result of that, we passed Senate Bill 42 this last session that tried to address one of the issues related to this contract and this service. So I guess my question is, in light of the passage of Senate Bill 42, how does that impact this contract?
We don't believe that Senate Bill 42 impacts this contract, Senator, because as I read Senate Bill 42, it deals with a conviction of a lobbyist in relation to a contract that was procured, and he was convicted for that fraud related to, or some type of crime related to that particular contract. In this case, that was not what happened. This lobbyist the lobbyist involved in this was not convicted in any way in relation to the third-party administrator contract that we're talking about here.
I'm sorry, we're not picking you up directly.
Oh, I'm sorry.
Still
I was
can't.
saying that. Can you hear me better now?
Not a little, but not a lot.
Okay, let me try to adjust my volume here a little bit. Yeah, is that any better?
Yeah, a little bit. Go ahead.
Okay. So what I was saying, Senator, is that we don't believe that Senate Bill 42 impacts this contract, and that the reason for that is that we don't believe that this particular lobbyist in question was convicted of anything in relation to this third-party administrator contract for workers' comp. And that's what the language of Senate Bill 42 deals with, and we don't believe that relates here, because the lobbyist was not convicted of anything related to this contract.
Well, I guess this is where we agree to disagree. Surprised at the position that the cabinet's taking on this, but Mr. Chair, in light of the fact that this contract does not take place on July 1st, I would really appreciate the opportunity for our legal staff to take a look at this. And as much, I would make a motion that we defer action on this contract for this month.
I second that, Co-Chairman Meredith. Clerk, will you please call the roll? Motion to defer.
Senator Douglas.
Aye.
Senator Southworth.
Aye.
Senator Yates. Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Yes. Number 153 on the routine PSC green list has been deferred. Thank you for being with us this morning.
Thank you, Mr. Chairman, and we're happy to provide any additional information that you might want in regard to this contract.
Thank you. Okay. Next item on the poll list is with the Department for Local Government. It is number 85 on the routine MOA pink list. If the representatives are here, please come forward and identify yourself.
Good
Good morning. My name is Billy Johnson. I'm the Executive Director for the Office of State and Federal Grants at DLG. And I have Jennifer Peters, who is Branch Manager in our Office of Federal Grants, and Jeff Hanna with me today, who's a local government advisor within our Office of Federal Grants.
Welcome. Thank you for being with us. Co-Chairman Meredith has questions.
Thank you, Co-Chair Cook, and thank you, folks, for being available to us this morning. I don't have any problem with the contract per se, but just I'm curious as to where this water district is in light of its past history. We know it's had some significant issues. I know we've made some investment into it. I guess I'm surprised, given the history of this, that really $90,000 is not a significant amount. So I guess I just want a status report on where Martin County Water District is in terms of being able to provide clean water to their customers.
Okay, so this is a continuance of an existing contract that was probably started back in 2018. And this is some remaining funds that they had on the first contract, and it expired at the end of the year. So given the fact that they've had, I think, some changes and delays in grant administrators changing, engineers changing, this project had been delayed. But now that they have still have this pot of money left, we needed to go back into a new MOA just so they could have expenditures for this year, to which, of course, the deadline will be December 30th. And of course, the scope of work is listed there in the contract as to what they plan on finishing out the remainder of the funds.
Do you know how much is spent total on this project?
I think it's 1.2 million that it started back in 2018, and these are Appalachian Regional Commission funds.
In with these funds, does this get them where they need to be? Does this address their issues?
Jeff, would you want to, since you were the administrator on this project, would you want to make any comments as to where you think they may be?
Good morning. Basically, this helps with some of their problems, but they have a whole lot of issues that are going on down there. And, you know, there's a whole lot of money that's needed to fix all of their issues, but this definitely helps them fix a few.
Not exactly the kind of warm and fuzzy answer I was hoping for, but again, Mr. Chair, I guess I'm just trying to grasp on how much additional investment may be required on our part at some point in time. And certainly this is a terrible situation. It goes back several years, and I guess I'm just a little bit disturbed that we're making an investment where we're not moving this along. Again, not putting you people on the spot, not being critical of you, but I guess I want to know what the plan is to get them where they need to be so that everybody in Martin County has access to clean water. Does anybody know?
Well, I can't tell you the total price tag that's needed to fix all of their issues, but I know it's a significant amount, because back when we started this project, which was around 2017-18 in there when we started working with them. And there was a big group of people that were in a discussion about all the needs. And this is an old estimate now. It was like $17 million were needed at the time. Well, we only had $1.2 million available. So as you can see, I think there's still a big need for additional funding to fix all of their water system issues. But this is a helping hand to them to help resolve some of their issues. And
Jeff?
to get a real good handle on the number, you'd probably have to talk to the actual Martin County Water District to see what the remaining needs are.
Jeff, is there, I know there's been a significant amount of ARPA money going for cleaner water across the counties. Do you all know how much of that money's been pumped into Martin County?
I don't have knowledge of that. That actually goes through our Kentucky Infrastructure Authority, but we can get that information for you.
I think we'd all be interested to know how much that went in there, and then how much is what is left to do to get that, because that's a pretty dire situation down there and been going on for 5 years now.
Meeting with him after this.
Any other questions or comments? And if not, I'll entertain a motion to consider the contract review.
Make a motion to consider it reviewed.
Motion by Representative Bowling. Is there a second?
Second.
Second by Chairman Meredith. Clerk, please call the roll.
Senator Douglas,
Aye.
Senator Southworth,
Aye.
Senator Yates, Representative Bowling.
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
Aye.
Chairman Cook.
Aye. Motion carries. Thank you all for being on here with us this morning. Next item on the polled list with Department for Public Health, numbers 102 and 103 on the routine MOA pink list. If the representatives are here, please identify yourself for the record. They're here in person. Welcome. Check the mic.
My name is Bob James. I'm the Assistant Director of the Division of Epidemiology and Health Planning in the Department for Public Health.
Welcome, sir. Thanks for being with us.
Thank you, sir.
Co-Chairman Meredith has questions.
No, thank you, Mr. James. Appreciate you joining us this morning. We appreciate whenever we get these contracts, we just get a thumbnail description of what they're for. But what caught my attention is this: we're developing a regional training center. I'm just curious, is who falls within that region? How's that defined?
So this will be a statewide, we'll provide statewide training. The center will be developed at Norton's Healthcare Center.
So when we say regional, it's
regional. It's based out of Louisville, if you would, sir, but
Okay.
it will provide training statewide.
So this will be available to every public health department in Kentucky.
Correct,
Is that what
sir.
you're saying?
Yes, sir.
And
Not only just health departments, but also facilities who have healthcare providers that are involved. So we'll be able to provide continuing education training for those folks that are involved on the front lines. This includes frontline infection prevention, control, and quality measures.
And I'm assuming, but correct me if I'm wrong, that the genesis of this is probably COVID.
Well, actually, it's not directly COVID, sir. It's all infection prevention and quality control, which happened to be in existence long before COVID came about and continues to exist after COVID. Infection prevention and control are measures that are necessary for all types of infection. And we've realized through COVID that we've perhaps not done as well in infection prevention and control in the last year as we had previously, and we need to ramp up, retrain folks, the CNAs, the folks that are on the floor that are working. We need to retrain them just as we would anybody else on proper infection prevention and control measures. And it goes beyond hand washing and donning of PPE and those type of things. There's a lot of things in infection prevention and control.
The reason I posed that question was whether it's COVID related or not is the fact that it's 100% federal funding. And so I thought possibly it was funding as a result of that, but I guess I'm concerned about what happens ongoing. This is actually you just go through June 30th.
So let me address that, sir. The funding is actually available to us through 2024. So this money that's not expended by June 30th will be rolled into a new contract from July on to continue that program.
So is there a specific federal program that funds this? I guess I'm looking for continuity of funding stream.
This funding is through multiple federal grants that are available to us from the Epidemiology and Laboratory Capacity Enhancing Detection Grant. And that is a grant that we've had for a long time. There's additional funding now that has not been available in the past to get this established. And there are requests to have this requests from the grantors to have this training implemented.
Well, I certainly see what's valuable, but I guess I'm curious as to how you measure success with programs like this. Do we have any indicators that we monitor to see if we're making a dent in this?
So we have had a long-standing relationship with the nationally renowned infection preventionist, Dr. Ruth Kirko, who is at Norton's. And so this is an extension of a long-standing relationship we've had with Dr. Kirko and the staff for infection prevention. With the additional federal funding that is currently available to us, we'll be able to enhance, create webinars that we can house for continuous use after they're developed. We'll be able to do regional trainings where on-hand training can be conducted and the participants can receive continuing education credit at the same time through this federal grant.
Is there a particular laundry list of infectious disease that we're focusing on, or is it across the board?
It's very much across the board. Infection prevention is a very broad topic. We want to prevent every type of infection that we can, and we need to standardize the control mechanisms. As you can imagine, throughout the state, there are many facilities, and we need to standardize that infection prevention control process.
I agree, but it goes back to one of my original questions: is how do you measure success?
So, on an annual basis, we will see the rates, the success, and what we had seen is that in 2021, those numbers had kind of gone up. So we weren't doing quite as well in 2021 as we had been, and so as a result, we're doing this additional training, just as you would for anything else. When you see things are kind of falling behind, people have been trained. You want to just retrain them over and over and over again, so it's just routine.
I certainly can identify with that, but where's the source of this data that if we wanted to look at it?
I don't have that data with me, but I can get it for you, sir.
I'd appreciate just
Absolutely.
kind of see what the historical trends are.
Sure.
All right, thank you. That's all I have, Mr. Chair.
Any other questions or comments? If none, do we have a motion to consider the contracts reviewed without objection?
So moved.
Second.
We have a motion and a second. Clerk, please call the roll.
Senator Douglas,
I pass this one.
Senator Southworth,
Aye.
Senator Yates, Representative Bowling,
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith,
Aye.
Chairman Cook.
Yes, motion carries. Thank you for being with us today, sir. Final items on the pulled list with Department of Travel, numbers 138 through 146 on the routine MOA pink list. If the representatives are here, please identify yourself for the record.
Hello, Mr. Chairman. I'm Mike Mange, and I'm Commissioner of the Department of Tourism. With me today is our Deputy Commissioner Mona Jewett and our Executive Director of the Finance Department for the Cabinet, Melissa Brewer.
Oh, did we do 103 on the,
I did them together.
we did them together, but we didn't talk about 103.
I don't think we did.
We didn't talk about 103, we just
That's
talked about 102.
Oh, I'm sorry.
That's a different issue there.
So just make the motion, last motion was for 102 only. We're doing the motion for 103.
Okay. Do we need to have them back? I bet we've lost them already. Is he left?
Did we make the motion?
Okay, on the,
Oh, he left.
gentlemen, bear with us for just a second. On the last motion was for 102 only. My last motion was to consider 102 considered reviewed without objection. So, I believe, sir, are you still with us? Will you come back up? We're going to go back to 103. Okay, we're good. We're in good shape then. Sorry. And gentlemen with travel, please bear with us. We'll come back to you here in just a second. We're going to go back and go to 103, and then we'll be right back with you. Okay. Welcome. If you all could please identify yourself for the record. Check your mic.
And I am the program director.
Green light.
Good morning.
There we go.
Ellen Bernard. I'm the program director for the Kentucky Women's Cancer Screening Program.
Thank you. And sorry for skipping you, but glad you're up here now. So welcome, and Chairman Meredith.
Yeah, thank you all for being here this morning, and certainly these screening programs are great, and the more funds we can put into them, I think more successful we can be in addressing these horrific diseases. I'm curious as to how this is coordinated with our managed care organizations who, are responsible for now over a third of our population in the state. So, and they're supposed to be improving the health of our population. So I'm curious as to how this interfaces with their efforts, if there are efforts there to really address breast and cervical cancer.
Our program was designed for uninsured only. So that's our population. It's a safety net program that's been in existence for 30 years, and it targets those that don't have any other insurance. So while we conduct outreach to all women, we target the uninsured. So it does not really interface with Medicaid and managed care.
When you say you target the uninsured, then exactly how does that outreach work, and how do you secure care for those individuals?
We have partners throughout the state that help us identify and reach the uninsured in their communities, and then we link them to our participating contracted providers.
Well, given that now we have over a third of our population on medical assistance and dominantly through the Affordable Care Act, have you seen the number of people without health insurance change significantly over the last few years?
Yes. I think my data manager has told me that before the Affordable Care Act, we would see 30,000 women a year, and currently we see 2,000.
How many? Excuse me?
2,000.
2,000. Wow, that's a significant improvement.
Yeah, it's good news and bad news, right?
Yep.
Yeah.
May not be a fair question, but that precipitous decline in numbers, is that because you folks are doing such a great job, or folks now have access to care that they didn't have access before?
Both. Can I say both?
Sure.
Maybe. Yeah. We still continue to do outreach for those folks because we've learned, as you all probably know, that even though you've got a Medicaid card doesn't mean you're going to go get screened. So we certainly do outreach to all women.
Say that again, about just because you have a Medicaid card.
That doesn't mean they're automatically covered as far as their preventive health. So you need to navigate them and identify them, reach them, pull them in, and get them screened is our job.
Of the, say, 2,000, that number that you quoted, do you know if those folks don't have insurance coverage because they choose not to, or unaffordable, or what's?
We don't gather that information. They cannot have Medicaid, Medicare, or third-party insurance. And often they are undocumented workers that work in the agricultural arena, that we take care of them.
And how do you reach out to those? I think those folks would be really hesitant to try to access care because of those very reasons. But
we go to the racetrack. We go to health fairs that's dedicated to their profession, and try our best to reach them.
How can we help you do your job better?
That's a wonderful question. It's 100% funded. We have a huge we have an issue with the undocumented that they're not eligible for Medicaid. So if a woman receives services through our program, she's automatically enrolled into the breast and cervical cancer treatment program, because we can't screen them and diagnose them and then not have them anywhere to go for treatment. So Medicaid and CDC have an arrangement where if you're eligible through our program, then they're eligible for Medicaid during that duration of treatment time. One of our major challenges is that the undocumented that we screen and that we take care of are not eligible for Medicaid under the Medicaid eligibility requirements. So that is our biggest challenge, and we would love help on that.
Well, I certainly appreciate that, and I try to educate people that there's a significant cost of doing nothing, and that we don't measure sometimes, and that's why I have such an interest in this. But certainly appreciate the work that you all do, and to see that kind of decline over the years is commendable. So appreciate the information this morning, and I thank you. But Ms. Chair, if there are other questions, I'll move to.
Any other questions or comments on number 103? Senator Southworth.
Yes, thank you. You mentioned a significant number of your 2,000 were undocumented workers, but can you give us an idea of maybe the amount that aren't and who they are?
Yes, our population is African American women, older, and Hispanics, and those are our target populations.
And percentage of the 2,000, how many are like what you would consider a normal neighborhood American versus?
I don't have the African American, but I do know that I was surprised by the high percentage of uninsured Hispanics, and it was 23% in the state.
Of Hispanics that are uninsured, or of your, okay.
Uninsured.
I'm just trying to get in the pool of the 2,000. I'm just trying to figure out,
So
are we
I'd
talking
say-
about they're 10% of the whole, or are they 50% of the whole?
Yeah. I would say probably half.
Okay. Thank you.
Any further discussion or comments on number 103? If not, we have a motion by Co-Chairman Meredith. Is there a second?
Second.
Second by Representative Bowling. Clerk, please call the roll.
Senator Douglas,
Pass again.
Senator Southworth,
Pass.
Senator Yates, Representative Bowling.
Yes.
Representative Hart,
Yes.
Representative Mentor, Senator Meredith.
Aye.
Chairman Cook.
Yes. Motion carries. Thank you, ladies, for being with us this morning.
Thank you.
Sorry for the delay. Let's go back to travel. Gentlemen, if you can just start over with your introductions, and we'll go from there.
Certainly. Thank you, Mr. Chairman. I am Mike Manget. I'm the Commissioner of the Department of Tourism. With me today is our Deputy Commissioner, Mona Jewett, and also our Executive Director of Finance for the Tourism, Arts, and Heritage Cabinet, Melissa Brewer.
Welcome. Thanks for being on here with us this morning. Co-Chairman Meredith has a question.
I do. Thank you. Appreciate you joining us this morning. And, obviously several contracts here. When you told them a significant amount of dollars, but the description that we have for each region just says multi. And I guess I'm curious is how are these dollars expended, and how do you keep track of how they're expended and what they're expended for?
Sure, I understand with the description where the confusion would come in. This funding is federal funding. It came from the Economic Development Administration under the ARPA program. Each state tourism office was given an allocation of money under a formula. Kentucky received $5,346,250 with that. Our plan was to turn that around and grant all of that money out to our partner tourism commissions around the state. These were the only funds available under the EDA program that allowed for tourism marketing. So the process that we put in place, pardon me, is that once we officially received the funds, we put together an application process. Each eligible organization had to send us their plan, how they were going to spend the money. It had to fall under the similar guidelines of our existing matching funds program that has been in place for many, many years. So similar eligible costs. Under the contract, they must report to us back on the ROI on each of the programs and its effectiveness.
And is there a follow-up audit for each of these areas?
The guidelines did not call for a follow-up audit. We do not have plans for that at this time.
I think you've done a good job in terms of them having to have a plan, having to have to report to you folks, but I guess it concerns me a little bit that how do we check the accuracy of the reports?
They actually have to submit to us, for example, if they run an ad, they have to send us a copy of the ad, a copy of the invoice, et cetera. So it's not just, we're not just taking their word for it. They have to show us the documentation of what they spent and how it was spent, and then we will compare that to the application to make sure it was in compliance.
What are the restrictions in terms of how the money can be spent?
I can send to you, Chairman, the guidelines specifically, but it's primarily marketing, whether that's print, TV, digital. It can be research as well for the local community, anything that helps them to recover from a marketing perspective to pre-pandemic levels.
You mentioned that these funds were allocated based on a formula. Can you give me some insight as to what that is? And again, I'm sure it's in part population based, but when you look at Louisville, Lincoln, it's 1.6 million.
Sure.
But you look at Cave Region Marketing, it's 270,000. So,
yes, sir. That's a great question. What we did was, because it was tourism based, we went back to the 2019 economic impact report that the Department of Tourism contracts with a company called Tourism Economics. What we did is, by county, we took the total economic impact, the share of the state impact. So in that example, Jefferson County, for instance, was 28.5% of the total economic impact. Therefore, they were eligible for 28.5% of those funds. And we did that for every county in Kentucky.
I guess that's logical, but in kind of an illogical way. You know, if we're trying to build tourism in these other areas, I mean, success breeds success, but if you don't have the funds available to expand beyond what you're doing, then it seems to be kind of counterintuitive.
Well, keep in mind, Mr. Chairman, that these funds, again, were for recovery marketing, trying to get back to that level. I will tell you that in a couple of instances, I've had tourism directors come up to me and say that even smaller amounts that they've received is more marketing money than they've ever had in any single year.
Oh, no doubt.
So,
I can certainly appreciate that. And I guess it's just a philosophical difference on how we need to expend funds in the state, but that may be a personal issue with me, but that's all I have, Mr. Chair.
Thank you. Senator Southworth.
Thank you. The 5 million something that we're talking about here that's been divided up, is that the same formula as we're familiar with that's normally in approximately like 2 million or so with the marketing dollars that we do to each of the tourism groups? Or is this?
No, ma'am. No, ma'am, it's not. That formula was compiled by the Economic Development Administration. I do not actually have a copy of what that formula and the allocations were for each state office. There was a total of $510 million available that went to state tourism offices, and the $5.3 million is what Kentucky received. I can try to track that down for you from the EDA if you'd like it, but we have never seen that exact formula. They just told us how much money we had available.
Okay, I think I may have misworded that. What I meant was our state tourism marketing money that we have normally given to each of our local offices.
The matching funds. Yes, ma'am.
The formula, yeah, I think it's 50-50 match, that formula. Is that the same thing as this, or is it something different?
No, ma'am, that is a different formula.
Okay. Well, I'm trying to get to the bottom of how many total funds we're going to see. Is this the total, all 5.3 million? This is a one-time drop. This is the only contract we're going to, or MO, whatever we're on here, MOA, that we're going to see, or they're going to be more? Because I know we had the 75 million that we did in the, I thought it was 75, could have been something different now. Whatever the final budget number was that we were expanding from the ARPA funds. Is that going to come through your office as well in similar fashion as this? Or is it going to be something totally different?
No, ma'am, you are correct. It will be coming through our office, and our plans right now, we work with the finance cabinet Our plans right now are to have a similar type contract situation. All the partners or recipients will have to receive signed a contract to come through.
Thank you. Mr. Chairman, I just want to make note here. Historically, and we heard earlier, it's been the approximately $2 million I'm aware of that gets allocated to the different local offices for marketing purposes. And now we come to find out, and earlier this year we were hearing that they wanted us to use ARPA money, which we did for this, and we come to find out there's a special federal fund through the EDA that's been $5.3 million. I don't remember that ever coming up in the discussions. And, you know, when you're talking about marketing dollars, it does concern me because, as I've mentioned, you know, my local economic development office, you know, there's a lot of money. There's a lot of locations to put black holes in marketing. And it concerns me, you know, the level of expertise and the type of marketing that we're doing and the money that's going into marketing. Right now, we're talking about potentially 40 times the normal money. That's not just getting to pre-pandemic levels. That's excessive of numbers of money. And I want to make sure somehow through these contracts or somehow the next ones, we just need to have on our radar. We need to figure out how these dollars are being spent and figure out some kind of an audit process on how it went, because I do think that's going to be a major concern as we move forward.
Any other questions or comments? All right, do we have a motion to consider the contracts reviewed without objection? Motion by Representative Hart. Is there a second?
Second.
Second by Chairman Meredith. All those in favor vote aye. All opposed, no. Clerk, please call the roll.
Senator Douglas.
Aye.
Senator Southworth.
Aye.
Senator Yates. Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Aye. Motion carries. Thank you for being with us this morning.
Thank you.
Thank you.
Final items on the agenda are 3 exemption requests to consider. I will, if you'll take a quick moment to look at numbers 12, 13, and 14, glance those over, and then we needed a motion to approve those exemption requests. And we can do those one at a time, or we can do all 3 together.
Motion to approve all 3.
We have a motion to approve number 12, 13, and 14 by Senator Meredith. Is there a second? Second. Clerk, please call the roll.
Senator Douglas.
Aye.
Senator Southworth.
Aye.
Senator Yates. Representative Bowling.
Yes.
Representative Hart.
Yes.
Representative Mentor. Senator Meredith.
Aye.
Chairman Cook.
Aye. Motion carries. 12, 13, and 14 exemption requests are approved. Before adjournment, let me just tell everybody, next meeting will be Tuesday, June 14th. And the July meeting will be Thursday, the 14th. So a little bit of change. So Tuesday, June 14th for the June meeting. July meeting will be on Thursday, the 14th. With that being said, do we have a motion to adjourn?
Make a motion.
Is there a second? I'll second it. All those in favor vote aye.
Eat a little donut on your way
Aye.
out. Eat a
We're
little
adjourned.
donut or bring one back
Bring
to
a
your
donut.
staff.
Eat a donut on your way out.
Bring it to your staff. Get rid of it.
All right.
Mr. Chair, it's 1 hour, not part of record.
No, I can't do 20. I can't do 23.